Welcome. I will be taking you through the different processes involved in developing the NSPs, what to expect at each of those stages, and the opportunities for engagement that come at any of those stages. To start us off, for you to be able to be strategic, it's important for you to map out and understand the key processes through which the NSP is developed. And through understanding those processes, you're able to understand or to clearly see the opportunities for you to engage at each of those levels. And for you to get that full understanding of what that looks like in your country context will help you be able to plan strategically your engagement and your advocacy, both on a short term, medium term, and in a long term. It's very important for you to note that different countries are at different stages of their NSP cycle. Some countries are fully implemented their strategic plan over the 5 years. Some are just beginning, some are actually midway, some are just developing their new strategic plan. So it's very important for you to find out at which cycle your country is in, whether it's at the start of the cycle, whether it is at the implementation level, or whether it is at the end. And you can always find this information through a contact person at Ministry of Health in your respective country, or a contact person at the AIDS Commission within your country. We looked at different countries and we know that the processes for developing NSP always different depending on which country you're coming from. We picked out these 6 critical steps through which NSPs are developed, and some of these could be similar to what your country goes through, or some of these could be different. But we wanted to paint a picture for you to understand how NSPs are developed and how you as an actress, you can engage in all of these different processes. To start off, to say NSPs are always developed by a planning authority. This can be Ministry of Health, this could be the AIDS Council, or could be any other national planning authority within your country. In my country, for example, the Uganda AIDS Strategic Plan is always led and coordinated by the Uganda AIDS Commission, working in partnership with other stakeholders. And of course, the AIDS Commission works with a consultant who helps to put together all of these processes and ensure that we have a strategy. And of course, this consultant does not work alone. They work in consultation with very many other key stakeholders. And I will try to explain how this happens. So let us start off with step number 1, formulation of technical working groups. So the development of NSP processes depend on a principle of meaningful participation. And in this, I mean the development of the National AIDS Strategic Plan should ensure that communities, civil society, academia, our development partner, and other key stakeholders are involved in this process. Therefore, the AIDS Commission or Ministry of Health ensures that technical working groups are put together to consult and bring ideas of different participants and different partners within the country. These technical working groups vary according to the country context and according to what the country wants to prioritize in their strategy. For example, in Uganda, we have a technical working group that looks at gender and human rights. We have a technical working group that focuses on HIV prevention. We have a technical working group that focuses on human rights. So it's very important for you to find out from your planning agency, in this case, which technical working groups are available at that initial stage while the NSPs are developed. And then you pick out which technical working group that you're able to join. It's very important for you to belong to these technical working groups because these are the working groups that actually are responsible for developing this national strategic plan. We move to level 2 or step 2, which is situation analysis. This is actually the stage or the place where consultants, together with the technical working group, look at the data available at the country. At this level, the planning team makes an overall assessment of the country's HIV and AIDS situation to deal with it more effectively. Trans activists are welcome to participate at this level and other stakeholders by reviewing the data that is made available by government and other development partner. But it's also important that at this level, as an activist, you're also welcome to present the data that you have generated from the different programs that you have been implementing. And this is very important, qualitative data that's usually not common, but very important to bring those best practices and to bring those issues from your community at this level while the country looks at the data available to prioritize investments and priorities for investments moving forward. Level 3 is usually an important level, and this is consultation level. So for consultations, these are consultations that are led by the consultant working with technical working group to understand the priorities of the communities. And these consultations, it's important to note that they happen at different levels. And these consultations can happen at a national level, but they continue down, trickling down to sub levels. In Uganda, for example, we'll have consultations at the national level, we'll have consultations at the regional level, and at the same time, we'll have consultations at the local level. So these consultations are really aimed at encouraging the principle of meaningful participation of key actors. And these actors, of course, include people living with HIV, civil society organizations, other government entities, key population, development partners, academia, and other key important stakeholders, including the private sector. Consultations meetings are usually organized to ensure that the consultant leading the development of this strategic plan is able to capture feedback and ideas from a wider group of experts. These consultations are organized at different levels, as I said, both at the national and the local level. At this level, trans activists need to find out from their National AIDS Commission or Ministry of Health or any other equivalent planning authority when these consultations are expected to take place. And you should support your activists or your colleagues to be able to attend these meetings, but ensure while you're attending these consultative meetings, you have your needs articulated, you have your speaking points ready, and you have consulted with your community, and you are coming in these meetings with the voices of your communities and not leaving anyone behind. Once these consultations are done, the consultant, together with the technical working group and the relevant planning authority, will go and already work on a draft strategy. And this draft strategy will be brought at level 4 for validation to you, the civil society, to you, the activists, to look at it and confirm that indeed this strategy speaks to the unique needs of your community and represents the actual needs of the community. So once this draft strategy is complete, the government consultant is required to present this draft strategy to the stakeholders for validation. It's very important that you find out from your AIDS Commission or Ministry of Health or any other equivalent planning body when this validation is taking place. Usually there is a calendar of events that is presented by the AIDS Commission or Ministry of Health, highlighting the different events that will lead up to the validation or to the final development of the NSP. So it's very important that you find out information when this validations meeting will take place. In this validation meeting is an opportunity for you to challenge what has been captured by the technical working group and by the consultant. It's very important to look at this draft strategy from the lens that Joshua already took us through in chapter 3. So looking at the budget that is provided Do we have enough resources that are committed for trans-specific interventions? At this level, it's an important opportunity for you to look at interventions or strategies included in this draft strategy. Are these interventions or strategies that you agree with? Are these the strategies that your communities provided during the consultations? It's very possible that communities will be consulted and your priorities on your interventions will actually not end up in the work plan or will not end up in the budget. Such an opportunity of a validation meeting is an opportunity for you to bring that feedback back to the Ministry of Health. And usually these meetings are attended by other key stakeholders who you can actually work with to support you while you make your case. Once the national strategic plan is validated or once feedback is given during the validation meeting, the consultant will go back and work with the technical working group to consider and consolidate all the feedback that has been provided and then develop a final strategy. And this final strategy will be submitted for approval and for dissemination. When the strategy is approved, and in this case, it will be approved either by Ministry of Health or by Cabinet of Parliament or by the Office of the President, again, depending at your country context and according to your policy environment. But approvals are given by a planning authority or by a certain office. And once the approval is done, it's very important to ensure that these strategies are not kept in the shelves, but they are disseminated and that partners understand these strategies and start to follow and how to and use use this strategy to inform most of their programming. When the strategy is approved, it needs to be disseminated widely to all key stakeholders. It's important for you to share the strategy within your own community and to align your organization program with the national plan. And we'll move on to the last cycle of the National AIDS Strategic Plan development. And this is the most important one. This is usually the strategy implementation and resource mobilization and monitoring. So I would like to say that national strategic plans are not only for the government. They are yours as well, as an activist, as a programmer, as a person who is implementing the HIV program in your country. This NSP gives you a framework through which you can operate, gives you a framework through which you can contribute and be able to report at the end of the quarter or at the end of the month back to the government in terms of your contribution as an advocate or as an HIV organization or as a key population or human rights organization. So strategy implementation is usually led by the AIDS Commission or Ministry of Health and is implemented by key stakeholders, including your organization. So it's very important that you take part in implementation. You can partner and work with government to ensure that most of these strategies that are put there, including interventions and budgets, that they are actually executed as planned within the strategy. National strategic plans usually have an M&E framework or an M&E plan, and that M&E plan aims at ensuring quality and timely HIV and AIDS information is generated to guide evidence-based decision-making on programming and policy making and to ensure that while we are implementing strategically to achieve the results. So the NSP M&E framework is an important tool for you to take on as an advocate to understand whether there are specific indicators that are set for your own community, and then work within your organization to actually monitor that most of these targets are achieved and that the government is reporting against these targets. And in our resource manual, we provided a couple of tools that you could use, whether it's a community scorecard to assess whether these services within the NSPs that are committed are actually being provided, whether it's a shadow report or whether it's a shadow NSP process. But it's very important that you follow through the implementation of the NSP and you're able to track and monitor. It is very good for you to participate from the beginning to the end, but it's also very important that the engagement and your participation does not only stop when a strategy is developed and it has the language and it has the intervention. It's very important for you to follow through and ensure that what is put within that strategy is actually the reality, is actually what is happening within the community. So that is the last level that we'll talk about. However, we know that NSPs are reviewed over a specific period of time. In some countries, NSPs are 5 years. In other countries, NSPs are 10 years. So usually mid-term or midway the process, NSPs are reviewed. So it's very important to find out when your country NSP is going to be reviewed. And when you're able to get that information, you're able to understand how you're able to strategically position yourself to engage in those different processes. So the review process takes the same shape. Again, coordinated by AIDS Commission or Ministry of Health, the government will look back midway to understand and assess its performance, whether it is delivering on the committed strategies, and they're able to understand where they need to actually invest more resources. So it's very important for you to find out where your country is, and then you're able to engage much more strategically. Again, the NSP processes are different according to different country contexts, but this gives you a clear picture of how a national strategic plan, AIDS strategic plan is developed. And allow me, as I conclude, make mention that the NSPs are a very important document. They act as an investment case. So it's very important that you are able to understand how they are developed, and then you're able to engage more effectively to ensure that the next NSP in your country or the current NSP indeed has a language that speaks to your community, and indeed it has interventions and it has budget lines and it has targets for your own specific community. Allow me to end here and thank you, and hope that you found this video very helpful.